Thanks for joining me in Mrs. Lavoie's classroom. Just a reminder, the ABA tips and tricks I share here are for educational use only and are not a replacement for professional behavioral services. Always consult with your own BCBA or healthcare provider for personalized advice. Let's get started.
Hi, everyone, and welcome back. Last time we talked about the big four, or the functions of behavior, and we learned to ask the why, right? Why does behavior occur? But do we actually know what the why is, or did we just guess? And in the world of ABA, we do not guess. We use a formal assessment called a functional behavior assessment, or FBA. So today I'm going to break down what an FBA looks like, potential risks, and most importantly, what happens after one is finished. So if you're a parent or a teacher who have just been told we need to do an FBA, this is the video for you. What is an FBA? Simply put, an FBA is a behavioral investigation. Think of your BCBA as a detective. Instead of saying, Sam is being disruptive, the FBA asks, what is Sam trying to tell us when he shouts out during math class? The goal of an FBA is to look at patterns. And in order to look at those patterns, we look at some specific things, and those are antecedents and consequences. Antecedents are things that happen right before a behavior occurs, and a consequence is what happens right after the behavior occurs. When we see the same thing happening over and over and over again, we find the function.
An FBA isn't just one person watching for 5 minutes. It's a 360-degree view that usually includes the following. Indirect assessments, the talk. We start by interviewing the experts, you. We talk to parents, teachers, and sometimes even the students. We also use questionnaires to see where and when the behavior usually happens. Direct observation, the watch. This is where I or a trained therapist sit in the natural environment, like the classroom or the living room. We take ABC data, which we just write down exactly what happened before, during, or after the behavior. Functional analysis, the test. This is where a clinician intentionally changes the environment to see which triggers cause the behavior. It's important for you to know that functional analysis is not always included in every FBA. And finally, data collection, the find. We take all those interviews and observations and put them into charts. And we are looking for obvious known triggers. So, does the behavior only happen when the iPad is taken away? Or does it only happen when a hard worksheet is presented? Once we see the pattern, we share hypothesis statements, which may sound something like this. The primary function of yelling is attention. There are 4 main risks we need to keep on your radar. During a functional analysis, you might see behavior escalation because when we start manipulating variables to see what triggers the behavior, we might accidentally trigger a major episode. So, if we're testing if the behavior is maintained by attention and we start withholding attention, the behavior might get more intense. Also, during a functional analysis, we might reinforce the wrong thing. So, the truth is, we say we're reinforcing the wrong thing, but we are reinforcing behaviors in order to confirm our hypothesis. If we aren't careful, the student might learn that the behavior, such as hitting or screaming, is now a guaranteed way to get what they want. Third one is relationship strain. An FBA requires close observation. For a student, feeling watched or analyzed can feel invasive. It can even damage the rapport and trust you've spent months building, making them feel like a lab subject rather than a person. And finally, the wait and see trap. FBAs take time, sometimes weeks. While we're busy collecting data, the student isn't getting immediate relief. This delay can lead to teacher burnout and continued distress for the student. So, does this mean we stop doing FBAs? No, it means we do them ethically. And here's how: safety first. Always have a crisis plan in place before you start observing or conducting the functional analysis. Be discreet. Use indirect assessments like interviews alongside direct observations to minimize the watched feeling. Informed consent. You need to ensure everybody understands exactly what the process looks like. It includes the parents, staff, and sometimes, when appropriate, the student. And finally, prioritize speed. Collect the data you need to be accurate. Don't let the assessment phase drag on forever. Now what? What happens after the FBA is completed? Well, this is probably the most important part. And first things first, you're all going to meet as a team to review the FBA because it'll be the blueprint for your BIP or your behavior intervention plan. Then the interventions that go into the plan are going to be implemented. They're going to put them in place and make sure everybody knows and understands what should be done, from modifying the environment to teaching replacement behaviors and changing responses. And finally, you're going to collect data or continue to collect data. The importance of data is to see whether or not the interventions that were put into place are working.
So, if you're in a school, a clinic, or even in your home and you hear somebody say, "We need an FBA," don't worry. It's not about labeling a child or labeling an individual. It's all about understanding them so we can give them the tools that they need to be successful. Remember, all behavior is communication, and FBA is just learning how to listen.
Thanks for watching. For more ABA insights, make sure to subscribe and follow. See you next time.